Well, hello everybody. Thank you so much again for coming today. I'm Dr. Joe, official name Dr. Joseph Novoa-Lieberman. And today we are going to continue with the class that you've already started to study online. Remember, we did our live presentation online and we did your questions and we went through it. And now you should have already studied all of that material again in your own time and should be prepared for the class today, which is your hands-on training. Okay, so I'm going to recap a little bit pretty quick on some of the major points that we need to remember when we're talking about neurotoxin treatments, in particular aesthetic neurotoxin treatments. Okay, we're going to be talking about the neurotoxin treatments and how to use them in aesthetics. So I'll be talking to you about the different brands and different names that there are out there. The different brands and the different... I don't know, how much can you edit this? Is it like a normal video or is it harder than that? Should I try and not make mistakes?
If we can try and get it as smooth as possible.
Because it's not like where you can... Or can you clip start?
We can clip stuff together, but I would say not in the middle of a sentence. So you have to go back to the start of...
Or pause and restart that whole sentence again, so that you know that it's like, oh, actually he doesn't want to use that one. Restart.
I would go back to sort of the... If you imagine you've got your scripted paragraphs, go back to the top of the paragraph, so the start of what you're talking about.
Okay.
Okay?
Alright. I just don't know how easy it is in comparison to like a normal video. It's probably harder.
You can stitch stuff together.
But it might look messy.
Yeah, you can.
Yeah, rather than being like live.
Exactly.
Okay.
So if we go back to your start.
I'm gonna go live like they are here. Okay? Thank you. Well, hello everybody, I'm Dr. Joe. Dr. Joseph Novoa-Lieberman is my official name, but everybody knows me as Dr. Joe. And we've all met already since we did the online training where we went through the slides and we reviewed the material that you have to learn for this day. So now we're here in the hands-on training day, and we're going to start off the day by doing a little bit of a recap of what you've already learned, okay? Just making sure that you really understand every essential point so that we don't make mistakes. But I am going to be guiding you every step of the way, so don't worry. Okay, let's just review a little bit of the anatomy again, because the anatomy is the most important thing, as I always say, right? So we'll look at the anatomy starting with the muscles we're going to be injecting. And then I'm going to briefly talk about all of the other muscles around there that we do not want to be messing with, as they are not going to benefit us in the aesthetic treatment that we're providing. Okay? So, in depth and every single detail in regards to irrigation, innervation, origin, and function as a whole is already in your brain, hopefully, because you would have already studied this and we reviewed that together. So today we're just going to really recap in a simplified manner so that it really sticks, because it's a long day today, remember? We have to learn every single step and you have to practice, and it's all about the hands-on. But let's review the anatomy. So we have at the top the frontalis, correct? So the frontalis, and I am going to be talking about just the way they move so that it's easier to understand how we're going to treat them. The frontalis, we know it's the main muscle of the forehead, so it's just all of this area going up to the back. So it's occipitofrontalis, so it has an occipital portion and the frontalis portion, right? So we know that it is basically the only elevator of the brows. It's the only muscle of the upper third of the face that actually goes up, that moves in that goes up rather than going down. So we're going to draw a little, just very little lines, up arrows of where it's going. It goes up, right? Over here is aponeurosis, and then continues to occipital part of the frontalis. So then we have your corrugator, correct? Corrugators. So they are a triangular muscle, and they're going to be going down as well. They're going to be pulling in. They're going to pull medially and inferiorly, right? So they're going to be pulling like this. And the procerus is going to be pulling down as well, which is going to be generating that horizontal line, and the corrugators mainly these vertical lines in patients, right? So it's all a bit of a pull down, pull down, pull down. And then when we go over to the auricularis oculi muscle, or oculi, this is also going to be pushing down, right? Obviously this part goes up, this part goes up, this one goes down, this one goes down, down, up, like this. Okay? I mean, I don't have too much movement because I've had some neurotoxin treatment maybe about 3 months ago, so it's wearing off, but I still have a little bit of it. So once we understand how the muscles are contracting, then we understand what we need to do to treat it, right? So don't go and chase a line. Don't treat the line. The line is just a result of that contraction. What we have to focus on is on the culprits of making that line. So target the muscle sections that are causing those lines. So let's start with the forehead. So the forehead, obviously we know it's pulling up and it's contracting in that fashion. It's going to be giving us the horizontal lines across, right? So we have the lines. We're going to have to treat certain sections of the frontalis so that we don't debilitate it to the point where it drops the brows. Because remember, the frontalis, the frontal part of the frontalis, is the only portion that is going to be elevating the brows. And if we relax the whole thing, it's going to drop it. So it's important to understand that. Okay, and that is going to be your main focus for today. I'm going to be talking to you a little bit about the lower face injection points and the muscles there, and how to inject the depressor angularis oris, the mentalis, and a little bit on the orbicularis oris for the lid flip. Okay, those injection points, we'll be talking about them, and I'll show you again on the little mannequin and then on the model from today. So just here, how are we going to safely inject? So now we know the muscles contract in a certain way. We have to target those muscles, but how do we do it safely? We'll stick to the protocols of amount of units you're going to be using per injection site and the dilution ratios. So we'll be talking about the dilution and how to reconstitute in a few minutes. But for now, I'm going to show you on here how we mark a person when we're going to be injecting them. And you remember your cheat sheet that I gave you that has all of the little dots of where it's safe to inject and where it's not. It has a light system. So it has, if it's red, it's dangerous, so don't do it. Like, just stay away from it. If it's orange, approach it with caution. And if it's green, go. It's safe. So how do we get to those? We're going to draw, a very famous mid-pupillary line. So mid-pupillary line, we're going to draw a line upwards all the way to the hairline. Yeah. Straight as we can. And then you can also do it inferiorly as well. So we have that line. Now that we've drawn that line, we're going to draw another line in the forehead, which is going to be a horizontal line, just right in the middle of the forehead. So imagine from the hairline up to the brow corner. So the medial portion of the brow corner. So you're going to see, okay, here to here. All right, it's going to be like this. All right, I've got that section. I'll show you on the little mannequin in a second. And then we're going to extend that line laterally so that we have what in American football is like the field goal. So if you know a field goal, this is the target area. You want to get that ball in this area. Okay? And this is the delimitations of where it's super safe to inject the frontalis, the frontal portion of the frontalis. So super safe. All of these are going to be a green light. So you can populate it however you really want. You can do it. So obviously, when we talk about the dilution and the amount of units, if we are injecting 4 units and the dilution has been 2.5 mil bacteriostatic sodium chloride solution in a 100-unit vial, we're going to end up having 0.1 mils of solution, right, for 4 units. So that will spread approximately anywhere between 1 to 1.5 centimeters, depending on the product. So you have to take that into consideration when you're doing the treatment. So you're not going to have to put injection, 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 injection. You're going to spread it out and then the product itself is going to relax all of that section of that muscle. So we're going to go, for example, you can go here, this is your limit. Here in the mid-pupillary line, in the mid-forehead line as well, and then right medially in the center, and then we can decide how we populate the rest of it. So again, we can go about here, you can go there, which I usually tend to do this pattern where I go in the middle of both, in between both mid-pupillary line dots, and I'll go up and it almost forms like a triangle, right? And then again, you can put it here and here. And all of those are green light, they're safe. And they're going to relax this movement, right? They're going to relax the lines from the forehead. So now what you say, well, they have lines here and they have lines here. Now this is something to consider. If the patient has a lot of lines coming laterally, but not really a lot of movement in the medial portion, you have to consider that what their muscles are like. So their aponeurosis probably goes even lower, and they have almost like a split sheet of the frontalis, like this, rather than like this. You see what I mean? So it's like this, rather than, well, it'd be like this, rather than some people have it. Some people have it almost like one single sheet. And all you see is a lot of lines across it. I believe the model from today has pretty much like a full frontal sheet. And some people, you'll see that they have it laterally. But just be careful, because when you're going to be trying to target that lateral portion, you're running into the risk areas. So if you go into the lateral portion here, as long as we're superior in lateral, we're pretty safe. Like, I would say this would be your orange dot. I don't seem to have an orange color, so I'm going to go with your little brown here. Okay? Safe, go ahead, do it. Help relax those lines that are coming laterally. But if they have them really, really laterally and inferiorly, you gotta be careful, because most of the time that is evidence or a sign that they have a compensation for a brow droop. So look at them overall, take into account their age, their skin tone, the laxity, see their skin condition overall, and see if what is happening. Is this, or could it be a compensation of a brow droop? Because the muscles in the forehead will try and overwork so that you can open your eyes wider. So you'll end up with some lines on the sides. So if you do put some neurotoxin there, boom, you drop it. I guarantee it's going to fall. It's going to not allow them to go higher. So it's going to end up with, it's going to not allow them to go any higher. It's going to end up coming down. So again, you have to assess every individual. Not to say that you can't, so there is what I like to call the anti-spock, or anti-crazy brow. And the anti-crazy brow, or anti-spock, goes here. Approximately about 1 centimeter to 2 centimeters